Joining us live right now as we continue to follow this breaking news is Rosalee Agas. She is the president-elect for the Hawaii Nurses Association. And Rosalee, if you don't mind, first question, that's a pretty resounding number, 96%. Your thoughts about what's transpired over the last 3 days of voting?
So the nurses, they've said it. And you know what? I've been telling the employer this, that they are all there. That they all have something to say. This is their voice. 96% of the nurses are saying this is what they want. So I'm hoping the employer will hear that.
And, explain why exactly, from your point of view, did so many nurses vote so overwhelmingly to authorize a strike?
So the one thing you'll always hear is nurse-patient ratios. And that's a way that allows us to make sure that there's only so many nurses for patients. So there's enough nurses for the patients. And the nurses, like in all the units, that's the one thing that really resounded with them, because the past 3 years have been tough. The nurses have been working pretty short. They feel so much stress themselves because they can't provide that quality care they want to. So by standing to this is their way of saying, this is how many nurses we need on the floor to take care of our patients and provide them the best care we could possibly give them, and feel like we made a difference. And we've been trying to do it, in between negotiations, and it hasn't been working. They haven't been listening. So I think this is definitely where the nurses are saying it's time for a change. The nurses believe that this will provide a safe environment for our patients, and that we hope that the employer will see this at the bargaining table next week.
Rosalee, if I could, according to you guys, it would be at least a 10-day notice before you strike. So this is just an authorization vote. But how would this, and I think this is a pretty obvious question, how would this impact Kapiolani Medical Center? Because by far, the most births in the state happen at that hospital, correct?
Correct. So what we've always felt, the nurses, is that we've been taken for granted. They work hard at Kapiolani. Every nurse there works hard, and you know what? I think it's been taken for granted that we've made things work. It's been short, but now they're recruiting. They're keeping these these nurses are coming in, but we're having a retention problem, because as soon as they come and they figure out they got to work really, really hard, where on the mainland they can work better and not as hard because of the ratios, they leave. So that's why here we're making a stance in Hawaii, in Kapiolani, that's what we need to make sure that there's an environment that the nurses feel safe in, that we can provide safe patient care. It kind of goes hand in hand. It's all about that workplace environment.
All right. Well, we really appreciate you taking the time to shed some light on this, and we will stand by to see what happens. Rosalee Agas, thank you so much for your time.
Thank you.